Welcome to Review Central. This is NCLEX Reviewer number 10, featuring questions on management of care. This reviewer is intended for those who are eyeing, or are set to take either the NCLEX-PN, or the NCLEX-RN. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous NCLEX exams. Let's begin. Question number 1. A health provider is asked by the supervisor to do billing paperwork prior to the services based on scheduled patients. One of the patients declines therapy due to illness. What should be done? A. Encourage the patient to have therapy anyway and leave the billing as is given the time spent. B. Correct the billing and provide the information to the supervisor. C. Make up for the lost session time at a later date. D. Document that the services were offered but not provided, leaving the billing as is. The correct answer is B. The only ethical choice is to correct the billing, as the services were not provided. Making up the time, billing for trying to convince the patient to participate, or billing for services that were declined is fraud. Question number 2. After 15 minutes of pushing, the baby's head delivers spontaneously, but then retracts back against the perineum. Gentle downward traction is applied to the head, and the baby's anterior shoulder fails to deliver. What is the next best step? A. Call for help. B. Cut a symphysiotomy. C. Instruct the nurse to apply fundal pressure. D. Perform a Zavanethli maneuver. The correct answer is A. Call for help. This is a shoulder dystocia. The fetal shoulders fail to spontaneously deliver, due to impaction of the anterior shoulder against the pubic bone, after delivery of the head. This is an obstetric emergency and maneuvers can be performed. Neonatology and anesthesiology should be on standby. Question number 3. What is the general term for the performance of an unlawful act? A. Malfeasance. B. Malpractice. C. Assault. D. Negligence. The correct answer is A. Malfeasance. Malfeasance is the commission of an unlawful act. Negligence is reckless disregard for another person's well-being. Malpractice is the negligence of a professional individual. Assault is one type of malfeasance, the act of inflicting bodily injury on another person. Question number 4. What is the most effective way to prevent postoperative respiratory problems? A. Incentive spirometry. B. Bronchoscopy. C. Bronchodilator therapy. D. Effective pain control. The correct answer is A. Incentive spirometry. Incentive spirometry is the most efficient way to reduce respiratory complications by preventing atelectasis. Incentive spirometry should be taught to all patients before surgery and encouraged soon after surgery. Incentive spirometry is very important in a patient with rib fractures or contusions to prevent pneumonia and atelectasis. Early ambulation also can help to prevent postoperative complications. Question number 5. Accurate communication is critical to successful preceptorships. What is the one absolute regarding communication? A. It is impossible not to communicate. B. Barriers to communication clarify intended messages. C. Communication is the same for everyone. D. Verbal and nonverbal communication are equally effective. The correct answer is A. It is impossible not to communicate. Communication is a complex, intricately woven, dynamic, and fluid construct of verbal and nonverbal cues interpreted through multiple filters. Examples are culture, generation, gender, perception, education, and lived experiences. The one absolute in communication is this: it is impossible not to communicate, whether accurately, inaccurately, with intent, or unintentionally through gestures, emotion, behaviors such as distancing, or touch. Barriers to communication distort or corrupt intended messages. The strongest form of communication is nonverbal, for example through touch, gestures, or silence. Question number 6. Which of the following is true of the Social Security Amendments of 1965? A. They provide medical insurance for persons age 65 and older. B. They established Medicare. C. They require funding by private donations. D. Both A and B. The correct answer is D. The Social Security Amendments of 1965 created two programs, Medicare and Medicaid. The legislation brought forth federal health insurance for U.S. citizens over 65, and for poor individuals and families who meet certain criteria. The final bill came before the United States Congress in March 1965. President Lyndon B. Johnson signed it later in the year. There were more than 500 amendments before the bill passed by majority vote in the House and the Senate in 1965. Question number 7. Select the choice describing TJC directives regarding privacy and confidentiality. A. Information must be placed in protected status if deemed necessary for personal safety. B. Patients must be interviewed and examined in surroundings that ensure privacy. C. Privacy is up to the patient. D. Both A and B. The correct answer is D. Both A and B. Information must be placed in protected status if deemed necessary for personal safety. Patients must be interviewed and examined in surroundings that ensure privacy. It is the responsibility of those who are given access to the information to protect that information. Question number 8. Which of the following is not part of the role of consultants in the strategic and operational planning of quality? A. Increasing awareness. B. Assisting in establishing timelines. C. Assessing the needs for staff development, training and education. D. Responsibility for outcomes and the level of care provided. The correct answer is D. Increasing awareness of quality initiatives and programs are part of the responsibility of the consultant in developing a quality plan. Assisting the staff in establishing timelines for the quality plan is another area of responsibility of the consultant. Assessing the needs for staff development, training, and education is an additional area of responsibility for the consultant. The consultant is not responsible for outcomes or the level of care provided. Question number 9. Which of the following precautions does not need to be considered by the nursing staff when dealing with a patient who has recurrent seizures? A. Put the room next to the nursing station. B. Ensure loose attire. C. Pad the headboard and keep the rails up. D. Have doctor order the blood level of anti-epileptic medication every 3 days. The correct answer is D. When dealing with a patient who has recurrent seizures, the nursing staff need not consider having a doctor order the blood level of anti-epileptic medication every 3 days. Additional interventions involve lowering the bed and removing any objects that could be harmful to the patient if a seizure occurs. Never place anything in the mouth of a person who is actively having a seizure. Make sure the bed is in a low, locked position. Always have a suction source readily available for a patient on seizure precautions, as well as an oxygen source. Intravenous access may be needed for administration with anticonvulsant medications. Question number 10. What behavior is defined by late arrival for consultation and unreasonable excuses? A. Aggressive. B. Irresponsible. C. Resistive. D. Ignorant. The correct answer is C. This is a resistive behavior. Such behavior damages patient-provider relationship. The behavior is not ignorant because the patient is aware he or she is late. That's why he or she is making excuses. The behavior as described is not necessarily aggressive. You have just completed NCLEX Reviewer number 10, which featured questions on management of care. If you wish to watch more NCLEX reviewers on management of care, check out our NCLEX Management of Care Reviewers playlist. Check out also our other NCLEX playlists for other reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central, and click or press the bell button to make sure you get notified whenever we post a new reviewer, or other review materials on this channel. Please like if you find this video useful, and feel free to share to anyone who may also benefit from it. We wish you all the best on your forthcoming NCLEX, and we look forward to your fulfilling career and professional life as a licensed PN or RN. Good luck and God bless.